It's a very important topic to think about how we get patient confidence now on this background of COVID concerns, which actually are multifaceted, and it's not one size fits all. I think that's very clear, that's coming out now, that the concerns people have are actually outweighing the concerns they have with their own condition in a lot of cases, and they are very different concerns depending on that individual. Maybe that's something that we are seeing when we're looking at, patients wanting to come back into hospitals, that they're not quite sure what the situation is, and they're not quite sure that they trust the information that they're getting and where the information is coming from. So trust is really, I think, an important factor that was coming out.
We have feedback that patients are scared of going back to the service. But for me, one of the things that I'm challenging NHS E&I about is how we're communicating with those patients about access to services, and really understanding, we can use that scared terminology, but actually understanding what it is that's scaring them going back into the service. COVID-19 has brought about really long-term changes to every aspect of healthcare. We've seen rapid discharges from hospitals, delays and cancellations to treatment on a scale we've never seen before. But we've also seen COVID-19 has prompted this swift uptake of, really innovative approaches to healthcare, which can make a real difference to patients' lives. The recovery from COVID-19 offers a huge opportunity for change and to embed all these newly discovered innovations. It's also a very dangerous moment because it's a point at which patients playing a part in the developing of any transformed NHS could fall by the wayside. So hopefully this unusual moment can be used to embed in the NHS at long last meaningful patient involvement. Patients were there for the NHS when we were expected to alter our behaviour. And now I really think we should be calling the patients are completely part of the reset.
It is also our own knowledge and experience that elective surgery has had a very slow restart. Emergency services are a bit of a different situation, but there are challenges there as well. The barriers are, on the one hand, I think that the most important one is the very simple fact that robust evidence around COVID is scarce still. There is reluctance from patients to some extent to return, and there is also quite a cautious approach from services and healthcare staff. So patient communication, I think, is key, and supporting patients to make the choices they feel are right for them.
There is a huge lack of communication and messaging about the fact we're going to, from what I hear, there's going to be something launched this week about getting people back into the workplace. But actually, where are the messages on the sides of buses that tells us how to find out if the NHS is really open for business?